Robotic knee replacement is something that has become very popular, and people often ask what it is. Robotic knee replacement in its current iteration is using high-speed cameras and machinery to place usually the saw, the cutting device, in space in an accurate manner. The goal is to add precision and accuracy to the work of the surgeon. I describe it to patients as a tool that if you were to survey your yard, for instance, you're going to use a laser surveying tool. Or if you hang multiple pictures in your house, you're going to use a laser leveler. You're going to use these tools because they save you time. And there are parts of the knee replacement procedure, which is a very lengthy procedure in terms of the steps involved, not in the overall time, but the amount of steps, about 150 steps to the procedure, where robotics can help in where that saw is in space because it saves you time among the saw cuts. It allows better visualization in the field in some ways because I'm not using cutting jigs that we have to apply to bone. And also in the current iteration, robotics helps us give instant feedback to what have we created, to the mobility of the knee when we place in trial implants during the case. And we're able to utilize those high-speed cameras to see how well balanced the knee is. There are also additive things such as pressure sensor points. We can see how tight the knee is, and we can really gain real-time feedback of how we think the knee is going to function. That's the greatest advantage today of robotics. But I assure patients, we are the ones who are analyzing the shape of the knee that it's in, creating a plan, and then executing that plan. It is not a robot. We're not Star Wars yet, maybe someday, but we are absolutely doing the case using this tool to help facilitate parts of the case. And if we have to tweak something, having the robot there is a time saver, absolutely. And I think it's the future, and I think that if you look across all industries, robotics has never left a single industry that I'm aware of. So I think it's a worthwhile technological advancement.